Hello, 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 my friends. Ah, wow, did anybody else's alarm clock not go off? If I didn't know any better, we lost an hour. Hello, everybody. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, March 14th. It is time for another national and actually international IC support group meeting. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to tell you that this is all in your head, anybody to demean you or insult you or suggest that there's no treatments or to suggest therapies. They're wrong. And I'm going to be able to help you through that. Hello, Pam. It's so nice to see you. Hi, Boria. So my alarm clock didn't go off, and so literally I was go managed to wash my hair. Done pretty quickly, just a little tiny bit late, but it is what it is. Hello, Ann. Hello, Barbara. Hey, Donna. All right. Now, see, you can tell I didn't get to do my hair because I got things all over the place. Well, anyway, that's life. Straight out of Blue Ridge, Georgia. Hello there. Hello, Luz. How are you guys feeling today? Alrighty. So, let me introduce myself. Hello, Kelly from Aotearoa, New Zealand. Hey, girl, nice to meet you. Do you know Dot Milne, who runs the IC support group down in New Zealand? She's a wonderful woman. Hello, Patty. Hello, Brenda. Brenda says, is bladder filling therapy bad? Brenda, what do you mean? Is bladder filling therapy bad because of scar tissue? Are you talking about the bladder holding protocol? Where the bladder holding protocol assumes that you don't have pain, you just have frequency urgency. And sometimes, let's see, how can I say this? Sometimes we develop kind of bad bladder habits. And the best way to say this is that you pee when you don't need to pee. And I'm extreme, and a lot of us are raised that way. I was certainly raised that way. My mother was like, go to the bathroom before you get in the car. Even if you don't need to pee, go to the bathroom, get in the car, or go to the bathroom before you go to school. And sometimes what happens is you're kind of teaching the nerves in your brain to go more frequently. And I'm not saying it exactly the right way, but that's where bladder holding protocol applies. Because with bladder holding protocol, what you can do is let's just say you're kind of used now. Let's say your bladder's completely healed. Your bladder's totally healed. There's nothing wrong with it, but you're still peeing every 20 to 25 minutes and you don't have pain. You just have frequency urgency. What they would have you do is hold it for another 5 minutes for a couple of days. So instead of 20 minutes, 25 minutes for a couple of days. And then you would extend it again, maybe hold it for 30 minutes for the next couple of days or for a week, and then go to 35 minutes for the next. And the goal here is to kind of gently retrain the nerves. And that is bladder holding protocol. It's not a therapy for IC. It's never done if you're in pain. You're never supposed to do that if you struggle with pain. Because if you're holding it and it's causing pain, you're actually jacking up the nerves and making them worse. Pam says, wish I could sleep. Yeah, honey, I'm so sorry, hon. Nighttime urination. So you guys, nighttime urination is usually because of something during the day, which has provoked the hell out of your bladder. And so that 1 cup of coffee in the morning that a lot of patients still do could keep you up at night for sure. Hello, Helen. Hi, Cindy. Hi, Beryl. Hi, Brenda. When the doctor wants to fill it and stretch it. So you're talking about a hydrodistension. Is a hydrodistension bad? Hydrodistensions are, they used to be required for a diagnosis of IC. They are no longer required for a diagnosis of IC unless your diagnosis is in doubt. If the doctor just can't figure out what the hell's going on with you, then yeah, that's when they're going to want to do a hydrodistension. Or if, for example, you've got blood in your urine. If you've got blood in your urine, I mean, certainly you want somebody to look at your bladder and see what the hell's bleeding, right? Um, in the old days, they did something called a high pressure, long duration hydrodistension, where they used a lot of pressure, filled your bladder up, really, really stretched it, left the fluid in there for 20 minutes. And the challenge with doing that is that you can actually puncture the bladder or rupture the bladder. If you've ever left the hospital with after a hydrodistension with a catheter, your bladder was ruptured. Okay, but if you look at the new AUA guidelines for IC, you will see that they no longer require and no longer want anybody to do a high pressure, long duration hydrodistension. They want you to do a low pressure, short duration that's much more gentle on the bladder. Here, can you guys hold on? My mom is calling me. Give me a quick sec. Hold on. I care for a 98-year-old and a 92-year-old. All right, everything's fine. Oh, ready. Ready. Welcome to life in the doing elder care. I'm telling you right now is really hard. And I'm kind of getting to the exhausted phase. If we didn't have COVID, I would certainly have help, but we have COVID. And I've been doing it all of the bathing and everything. Amy says, inside Snowmageddon in Colorado. Pam says she has insomnia. Oh, Pam, you know, sometimes insomnia comes with menopause. In fact, God, I just read a really good article on insomnia last week. You know what you should do is Google menopause insomnia, and maybe it'll give you a couple of good techniques here. You know, like, you know, it's important to try to go to bed at the same time. It's important to leave your electronics out of your bed, which is very hard for me to do. Maybe trying something like melatonin or Pam. This might be interesting for you to try. This is a new tea from Harney and Sons. They make the brown rooibos tea that we recommend for ICers. This is a mint CBD hemp tea called Chill, and it's specifically meant for people who struggle to sleep. And no, I'm sorry, it's not peppermint, it's chamomile. It's chamomile and CBD. And it's all about, here we go. Chamomile and mint are masterfully blended to create a caffeine-free herbal infusion. It's combined with 16 milligrams of hemp extract to make a delicious brew to end your day. Our body relaxing, mood elevating infusions deliver a cool, calm, and delicious experience like no other. We strive to make it just a little nicer in everything we do. Anyway, so, you know, something like this, this would be, I mean, we know chamomile is obviously really, really good for your bladder. It has a nice antispasmodic effect. Same with mint, but if you've got GERD, you can't do mint. But a little bit of chamomile combined with a little bit of CBD might be interesting. So think about that, Pam. You can get that at harneyandsons.com, or you can get that in our store. You know, I'm always looking for things that would be helpful. Because, girl, I am there too. Hello, Pamela from Greeley, Colorado, having a monstrous snowstorm. I'm glad you got power. Hello, Tabitha. Tabitha says, I've had 3 UTIs this year. Last one came back negative, but I told my doctor I know it's a UTI or IC. She gave me antibiotics, and I'm getting much better. So frustrating. Doctors are still using those tests that aren't always right. I've done microgen before, and now my doctor doesn't do them anymore. Well, you can order them yourself, hon. You can order a microgen test. You will need a doctor's signature to get the results. But, you know, UTIs are tricky. UTIs are challenging. A lot of UTIs are drug resistant, and especially if it's E. coli. E. coli is an absolute master. It's a master at defeating our own natural body defenses. It does that by changing shape. It goes from kind of a round blob to a noodle. And when it's a noodle, your white blood cells don't recognize it. And the other thing that E. coli does is really quite dastardly, is in the presence of antibiotics or in the presence of a major threat, what it does is it creates basically the equivalent of little seeds, passive seeds. They're not active, they're passive. So what it does is it kills itself, and it takes an I don't even ask me how it does. I don't even know how it does it. You end up with a little piece of DNA or an or RNA surrounded by a little bit of cell membrane. And so they're little spheres of DNA that just live in your tissue, and they're completely passive. They're not active infection. But then they get turned on, and it turns out they get turned on by our own body's healing process. So there's a wonderful researcher named Scott Holtgren who's been doing it. And over on my Twitter page, fascinating picture of a white blood cell chasing a bacteria. It's incredible. Go over to twitter.com/ICAndJill. I just shared it like 2 days ago. And you can actually see one of your own body's fighters actually chasing a little tiny bacteria. And you're wondering, well, it doesn't have eyes. How the hell does it do it? And it does it through a chemical trail. And it's really adaptive. If the bacteria darts to the left, it oozes to the left. If it goes to the right, if it goes fast, it's amazing. The human body is stunningly complex. And it is the one thing you really need to have some faith in, because the human body is designed for healing. Wherever you're hurt, your body is trying to fix it right now. Like for me, I've got 2 ruptured discs in my back, and it's hurting my right leg. And I know that my body's trying to heal what's happening, that my nerves are trying to calm down, and that my muscles are trying to calm down. The challenge is, especially for bladder stuff, we get in the way of healing. You just get in the way, man. If you're drinking a soda a day, a coffee a day, and you've got a bladder wall injury, IC subtype 2, then you're going to prevent your bladder from healing, because the bladder is the slowest healing organ in the body. It takes 2 weeks for one freaking cell to be replaced. 2 weeks. So if you only try the diet for 2 weeks, you've done nothing. If you're drinking 1 cup of coffee a day, 1 soda a day, you're destroying any damage you're destroying any new cells that are trying to repair the damage. You are. If you were taking cystoprotek or anything like that, or Elmeron, even though we're not really doing Elmeron so much anymore, and you're drinking a cup of coffee every day, you're voiding the effect of the potential therapy, because it's just going to wash out the Elmeron and wash out the chondroitin. Yeah, this is about wound healing and repair for many of you. Many of you. Georgia says, is PEA a cannabinoid? No, it is not a cannabinoid. It is THC free. Palmitoethanolamide we had a major research study that came out 2 years ago that showed that PEA was stunningly successful at reducing pain in IC patients. That at month 3, 87% of patients using it had a significant reduction in their pain. And by month 6, 25% were pain-free. That was a study from Europe. They've used PEA in Europe for decades for all sorts of pain. It is wonderfully successful. There are literally no side effects to it in the IC study. People ask me what I take, and that's what I take when I start feeling things getting amped up. And let's see if I have it right here. I do. So in the US, we have Piora. And this is made by Natural Approach Nutrition. And it's an almost match to the formula used in the IC study, which we can't get in the United States. So we have to have our own variant. All right. All right. Oh. Hello, Mette from Denmark. Thank you for joining us today. I hope that life is treating you well. Hello, Natalie. Is hydrodistension beneficial to help with pain? A doctor is suggesting this, and I just don't want to do it. All right. So here's the deal. A hydrodistension is what I call a destructive therapy. It is not a constructive therapy. It is a destructive therapy. And so why do you feel better after you have a hydrodistension? Because it breaks the nerves in the bladder wall. When you stretch the bladder wall, or stretch the bladder, you also stretch the nerves and the nerves get broken. And so after your post-op recovery for a couple of days, you notice that your symptoms are stunningly better. Why? Because the nerves are broken. But the nerves always grow back. That's why you start feeling worse in a couple of months. And unfortunately, the problem here is sometimes more nerves grow back than you originally had. And so, we want to focus instead on constructive therapies, therapies that will help build rather than break down, right? Bill on YouTube says, would it be okay to have Elmeron installations? Yes. Elmeron topicals do not become systemic like an oral medication. So for those of you who are new here, we now know that Elmeron is linked to a pigmentary maculopathy, a very severe eye disease, and we have some patients who have actually gone blind from it. And so, that's a whole nother story. Be happy to get into. And by the way, we have a new Zoom meeting coming out with attorneys who are going to come back in and tell us what's going on with that. I will be sending out an email on that this week. I think on the 22nd. The meeting is on the 31st. And you can ask questions of the attorneys yourself of where they are with the litigation, because there are over 200 lawsuits now, and there's probably going to be quite a few more. So anyway, when you swallow Elmeron, it gets absorbed into your bloodstream. And we now know apparently either the Elmeron itself or a byproduct, a metabolic byproduct or metabolite of the Elmeron somehow arrives at the retina and damages the retina. But if you use it topically as a bladder installation, you don't get the systemic absorption. And that's true for estrogen. If you're using topical estrogen therapy, it's true if you're doing rescue installations with heparin and lidocaine, Elmeron and lidocaine. The one thing that would increase absorption that you got to be really careful of is sodium bicarbonate. So if you look at a typical rescue installation formula, and you can find those all over on our website at icnetwork.org, they're usually a coating. And that's going to be heparin or Elmeron combined with lidocaine as a numbing agent. They might put a steroid in it, maybe an antibiotic in it. But the most important ingredient in it actually is sodium bicarbonate, because it's sodium bicarbonate. If you alkalinize it just a little tiny bit, it improves absorption. And I remember I interviewed the guy, Richard Henry in Canada, who actually invented it. And they didn't bring it to the public for a couple of years because they were looking for the correct dosage of sodium bicarbonate, so they didn't end up killing people. Because if you get too much lidocaine in your bloodstream, you're screwed. You could die. And so for those of you who are doing home installations, you should never, ever, ever change the formula or increase sodium bicarbonate. Bill says, so should Elmeron installations contain sodium bicarbonate? I don't believe that they should because of the risk. Heparin lidocaine ones do contain a little bit of sodium bicarbonate. The only study that we had which told people never to use sodium bicarbonate was a study done by Deborah Erickson at the University of Kentucky on pregnancy. And they recommended that any patient who's pregnant never, ever, ever use sodium bicarbonate, because that would allow the sodium bicarbonate to reach the fetus and allow the medication to reach the fetus. Georgia says, what kind of yeast is recommended for baking? I don't know. I just get yeast. I get quick rising yeast when I make bread. Sammy says, let's see, hold on. Hello, DJ. Hello, Kelsey from Florida. Hello, Debbie. Laura says, should we be concerned about taking the COVID vaccine? If so, which one? Hun, listen, we're doing the only COVID and IC research study. And I've got over 100 patients in that study. I haven't even looked at the data in the last month because I've been so busy. Getting COVID with IC is devastating for some of you. 75% of the IC patients participating in my study report a great worsening of their symptoms, and 25% of them report extremely severe IC symptoms that are not responding to any of their traditional therapies. And so, what do we think is happening there? Well, as I said in the article I did a month ago, or in our magazine 2 months ago, is that we have 4 research studies that have found active kidney infection, viral kidney infection, COVID infecting the kidneys. We have 14 studies that have found active live virus in the urine of patients. And so we actually think that the virus is infecting the bladder itself in this 25% of patients who report that their symptoms are much worse. There's also some patients who have been brought out of remission and their IC symptoms come back. Now, the good news is that that's fairly short term. I mean, a couple of months, but it's a fairly wicked IC flare. So if you have to compare the risks of an active COVID infection versus the risks of having a vaccine, which might give you a flare for a week, if that, maybe a couple of days, I mean, listen, my bladder is happy right now. I fully intend to get the vaccine because I don't want to risk getting an active COVID infection. I can't get it yet. I'm still too young, here in California at least. DJ says, I'm having major insomnia, hysterectomy at 33, 7 years ago. Yeah, insomnia is just challenging. It's challenging. Somebody's getting something every 3 months and they've saved my life. Cindy says that she also is afraid of the vaccine. You know, I was looking at one research study, and it was a research study of anaphylactic reactions to the COVID vaccine from all of the companies, right? And they've given millions of doses. Like almost everybody in my family's had it now, except for our household. And it was like a 0.015% anaphylactic reaction. So I mean, the odds are just so tiny. But I admit that I'm scared too. I had a really weird reaction to my flu vaccine last year, and I ended up in the ER with my heart racing. So, honey, Cindy, I totally get how you're feeling, but you know, it's usually done in hospitals with good medical care providers. And the cool thing about that study, that nobody died, they just had a weird reaction to it, and they were sent home. You know, they went to the ER, they helped them, they gave them fluids, they got them out of whatever they did, and life went on. So Natalie says, "A slippery elm beneficial for IC. I want something to help with pain and urgency, but I'm worried about IBS being affected. I have endo, IC, IBS." I mean, it's one of the things you can try. It's certainly not common. I would put slippery elm in the same category as marshmallow root. Marshmallow root helps some people, but not others. So, you know, I mean, you could certainly try it. You better make sure it doesn't have vitamin C or acid in it. It would be, you know, kind of my position here is that you can chase alternative therapies and lose a lot of money that way. I think it's important to focus on the things that we know have been studied with IC. And that's going to be a product containing chondroitin, a product containing PEA, or a product containing aloe. So that's going to be the Bladder Builder, Bladder Rest, cystoprotek, cysto Renew, cysto Mend, Aloe Path, or Desert Harvest Aloe. Julie said, finally I had sex for the first time following Hunter's lesions removal of Hunter's lesions. First time in 6 years. Thought I was gonna die. Oh, what? Pelvic area felt like I was being okay, honey. So Julie, because you had Hunter's ulcers that are extremely painful, your muscles got tight. You know, I call it the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. They're both involved. They cannot not both be involved because they are so incredibly interconnected. And so your muscles got tight because your Hunter's lesions were screaming in pain. And so they treated the lesions, but did they treat the muscles? Because it's really hard to have sex if you've got tight muscles. Georgia says, "Do you think that an allergist can help with IC doing?" Yeah, I mean, it's not going to help. I like data, I like facts, and if you already have pre-existing food issues that could potentially be affecting you, I say, why the hell not have a little bit of food? You know, you can do a blood test that will test for food allergens. Sammy says, anyone got any stories on cystectomy? Girl, I have a whole message forum over on our website. It's the oldest, longest support forum in the world. And yes, y'all are on Facebook, but back in the old days before Facebook, you were over on the IC Network website. And we still have quite a few patients who go over there every day and participate. There's a whole discussion board dedicated to cystectomy that's run by one of our best volunteers who had a cystectomy. And so if you're looking for real life stories, Sammy, going over to icnetwork.org, go into the support category, go to our support forum, and you'll find it right there. You'll find tons of real life stories. Let me just say, you guys, with cystectomy means bladder removal. It is rarely, if ever, done in IC patients. I mean, in the old days, they used to do quite a bit more, but now we know about the subtypes. We know that muscles can be involved, nerves can be involved. So cystectomy is not common at all. It's a step 6 treatment option. And then, according to the American Urology Association, they will not even consider it until you've done steps 1 through 5, every therapy there. And girl, if you're thinking cystectomy, I really hope you'll call me this week and let me go over some stuff with you too. Maybe you've missed a couple of things. So the context for cystectomy is usually that you have a very scarred, damaged bladder that's shrunken. So, you know, your bladder is like a balloon, right? It's small. And then as it fills, it gets bigger and bigger and bigger. And it's fascinating biologically how that happens. And then when you pee, it gets small again. And then it stretches, and then it gets small again. But if your bladder has stopped stretching and now you have a bladder that's like the size of a walnut, that's when they will really consider doing a cystectomy or a bladder augmentation to give you a little bit more capacity. But guys, you know, listen, I hate to talk about that because I don't want to scare anybody. Now, listen, we don't think of IC as an incurable bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because we know that other structures are often involved. We know that if you have a fibroid tumor pushing on your bladder, it could cause pain. If you've got endometriosis on your bladder, it could cause pain. If you were a bike rider, like a gentleman that I was working with on Friday, yes, you could have a nerve injury, a muscle injury that could be causing your frequency, urgency, pressure pain. If you've got one leg longer than the other, that could actually cause all of this. Because if you've got one leg longer than the other, your hips are not even. You got one hip higher than the other. They're doing this when you're walking. That's putting stress and strain on your muscles. Eventually, your muscles are going to start getting tight and dysfunctional. We got blood flow that is now affected. And ischemia, tight muscles cause a reduction of blood flow to the bladder, and then the bladder wall starts to break down. That is called the somatovisceral reflex. And so, yes, you're thinking like me at literally my first or second doctor's appointment. I begged him to take my bladder out. It hurt so bad. And he's like, no, not going to do it. We haven't even tried anything yet. And and my bladder is perfect right now. I just, thank God we didn't go down that road. Having a cystectomy is a long recovery. It's a 1-year recovery. And you need a lot of support. It's extremely difficult. So again, we got to rule out everything else. And speaking of that, this is the book you got to get if you don't know what the hell is wrong with you. If you're not responding to bladder therapies, if your bladder is getting worse rather than better, and or The doctor keeps looking in your bladder and it says it's normal. There's nothing wrong with your bladder. We don't know why you have these symptoms. We don't know why you have this pain. Bam! This is the book, Facing Pelvic Pain. Just came out and it's free on Kindle Unlimited, guys. It's free. This is a book that goes through all the other conditions that can cause pelvic pain and bladder symptoms. And it's written by some of the best doctors in the world. So it's got, and I was very honored that even though I'm not an MD, I was also invited to contribute to this book. I wrote my own chapter on this book on IC support. So this is published by Massachusetts Gen, also known as Harvard. Right? Okay, so let's see here. Chapter 3, what gynecological conditions can lead to pelvic pain? Chapter 4, what male urological problems can lead to pelvic pain? Chapter 5, what common urogenital problems can lead to pelvic pain? That can happen both men and women. For example, they talk a lot about the urethra in here. Like, have you ever heard of a urethra caruncle? A urethral caruncle is a little urethral prolapse that can happen in men and women. What GI problems can lead to pelvic pain? What musculoskeletal problems can lead to pelvic pain? Chapter 8, what bone and ligament problems can lead to pelvic pain? Chapter 9, what neurological problems can lead to pelvic pain? Chapter 10, what rheumatological, neuroinflammatory, and vascular things can lead to pelvic pain? That's just part of it. And here's the deal. I have 10 copies to give away. I have 10 copies to give away, and this is our giveaway for today. But I'm going to make it a little bit more challenging for you. So there are 2 versions for this. There is a full color version, and then there's a black and white version. I have 10 of the full color books. And so if you want one of these books, I need you to send me an email, icnetwork@mac.com. But here's what I need. I need you to share your best flare management tip. I need your best flare management tip. Donna, yes, the book is on Amazon. Bill, this is the book. This is the book you need. This is the book that will help you understand urinary urgency, because frequency, urgency, pressure, pain are all the constellation of symptoms that we see with IC and pelvic pain. Okay, so my email address, if you want a free copy of this brand new book that is so freaking awesome, we needed this book 30 years ago. I can't tell you how important this book is. If you don't know what's wrong with you and you think it's not your bladder, or if your bladder looks normal, this is a book that will help you figure out what is wrong with you. Send me an email, icnetwork@mac.com. I need your best flare management tip, and I need your mailing address. Okay? I promise you, this book will help you. And if you were buying it from us, and we're not selling it, you can get it on Amazon. I would buy it back from you if you found it useless, because I do not believe you will find it useless. Okay, but this is a freebie. If you want it, I will give it to you, but I need a good flare management tip. icnetwork@mac.com. All right. All right, let me have a little sip of my mint tea. Somebody asked if I had read the new James Malone Lee book, and the answer is it is the next book. That is this book, Cystitis Unmasked. With my CVS pharmacy. What is this? Oh yeah, this is my TMJ guard. Anyway, no, this is my next book to read. I don't have any comments on this right now. Let's see. Hold on a sec. Somebody said, Joanne says, hydrodistension ruined my life. Joanne, what happened? Straight out of Blue Ridge, Georgia, peppermint tea is fine. If you can tolerate peppermint tea, that's fine. Go for it. Peppermint tea is proven in research studies to be a smooth muscle relaxant. If you ever have to have a colonoscopy, drinking a cup of peppermint tea beforehand would be great because it would reduce the spasms from that. And that's what that research showed. But if you have GERD, you could end up belching peppermint all day, and that's uncomfortable. So some people can do peppermint, some people can't do peppermint. Patty said, 2 weeks to heal is what my urogyne said would take for my bladder to heal from the injury it got from my hysterectomy. I got a little excited because I knew that fact. Yeah. So guys, also the other time that we really have to look for is if you're having some sort of pelvic surgery, the bladder can be ruptured. And so they normally, if you're having a hydrodistension, if you're having a hysterectomy, they do a hydro to make sure they didn't accidentally cut your bladder or get a suture through the bladder wall. Sue says, yeah, hydrodistension ruptured the bladder. But the low pressure, short duration ones are much safer. And what you can do is ask your doctor, are you going to do a high pressure or low pressure? Are you going to follow the AUA guidelines and do a low pressure? If he says no, then I wouldn't do it. If he says absolutely, we're trying not to hurt the bladder, then, listen, if you don't let them look in your bladder, you're forcing them to guess. And I think that that's a mistake. If you've been in pain for 6 months or a year or longer, and you've never let them look in your bladder, you're forcing them to guess. And that's really not good enough. So I've often told the story of one of our patients who was terrified of having anybody look in her bladder. She waited 5 years. She suffered for 5 years. And when she actually did, they found a bladder stone, a really big bladder stone floating in her bladder, cutting her bladder wall. And it probably happened because she got very, very dehydrated and some crystals, it crystallized. Some of the minerals in her urine crystallized, or they could have actually been produced by the bladder wall. The point is once they found the bladder stone and they broke it up, what do you think happened? Her bladder wall healed. So at some point in time, it's important to let them look. You could do a cystoscopy in the doctor's office. I call that a looky-loo. It's a 5-minute test, numb the urethra, stick a cystoscope in, take a look around, pull it out, you're done. They would see bladder stones there. That's very different from a hydrodistension, which is in the OR, which is an outpatient procedure, but at least an in-office cysto. Shannon says, what supplements would you recommend for pain and constant urination? Well, so guys, understand that therapies, to talk about the right therapy, we have to understand what your subtype is, right? We have to understand your anatomy. What is going on with your specific anatomy? Thank you, Christy, for the 50 stars. I really appreciate that. So, we have 5 fundamental subtypes for IC. Number 1, Hunter's lesions. Number 2, bladder wall driven. Number 3, pelvic floor driven. Number 4, pudendal neuralgia. Number 5, central sensitization. So let us assume that your frequency urgency is from estrogen atrophy, which would put you into IC subtype 2. What supplement would be appropriate there would be one that contains chondroitin, because chondroitin helps to protect the bladder wall. And so that would be okay. Let me just show these to you. I can tell a storm's coming because my hair is getting all frizzy. All right. So the supplement that was the top dog for almost 20 years until 2 years ago was cystoprotek. Cystoprotek was created by major IC researcher Dr. Theoharis Theoharides at Tufts University. It combines chondroitin and hyaluronate for the bladder wall with quercetin for an antihistaminic effect. And because he's a federally funded IC researcher, he did a large study of over 250 patients who took this for 6 months. And he proved that a chondroitin-based supplement is helpful for the majority of those patients. I remember the exact data on the study. It was published in the Canadian Journal of Urology like 15 years ago. You can find it on our website. But we've learned a lot about IC since then. We've learned a lot about nerves being irritated. So this is a fairly old formula. And unfortunately, Dr. Theoharides signed a non-compete agreement when he sold this. So he can't create a next generation formula. So this right now, there's a manufacturer's delay. We haven't had it for months. We're not going to have it for another 6 weeks, probably. So it's off the table anyway, if you wanted to try it. The supplement that came along after that was Cysto Renew. And Cysto Renew is created by Dr. Gio Espinosa, who is a director of integrative urology at New York University. This was created 6-7 years ago. And what he did is he added, in addition to the chondroitin and the quercetin for the coating and anti-inflammatory effect, he added lemon balm, which has a nerve calming effect, as well as a little tiny bit of aloe for the soothing effect of the aloe. And so we had this one. Then this one came out, right? Whoops, hold on. And I'm going to say the majority of these users who tried this liked this better, but some people still like the old formula, right? But this also is not available right now. There's an extended manufacturer's delay, and they've given us nothing. That's because of COVID. COVID has messed up all the manufacturing facilities. But then 2 years ago, something remarkable happened. And that is we had this new PEA study, this palmitoethanoalamide study, coming out of Europe, which showed that it was stunningly successful at reducing pain in IC patients. That by month 3, 87% of patients had a significant reduction in their pain, and by month 6, 25% were pain-free. And at that same time, there was a group of us, including IC researchers, myself, a couple of other people. We were playing with another supplement formula, just kind of trying to revision what would be more helpful, a true next generation formula. And that is, in fact, Bladder Builder. So Bladder Builder has chondroitin for the bladder coating effect. It's got quercetin for the antihistaminic effect. It's got some beneficial probiotics for the gut. It's got some good amino acids in it. But most importantly, it has PEA in it for pain relief. So this has been out for about 2 years, and we just did our 1-year follow-up study, and 40% of the patients who tried it stopped using it. They either couldn't afford it, or their doctor wanted them to do something else, or they had a gut-related side effect, which happens with all of the supplements. But 60% of the patients who tried this are still on it today. And that's really good for a supplement. And more importantly is what's happening with their symptoms. So 25% of those patients, or 22 or 25%, are now pain-free using a PEA product, which is exactly what we expected. They have less pain, they have fewer flares, they have shorter flares, and they have less painful flares. So the top supplement right now, in my opinion, because it's the first one to provide a pain-reducing effect, is Bladder Builder. And you can get this on our store. If you're somebody you're sensitive to supplements, you flare when you eat yogurt, you flare when you take probiotics, then you can't do Bladder Builder. It's too complex. It's a really robust formula. So the next thing you would do is Bladder Rest, which is a really clean, pristine formula. There's not a lot of ingredients in here, right? Okay, including there's no probiotics in here and there's no PEA in here. But you could also do Bladder Rest and PEA, right? You could combine them if you wanted. Or if you like aloe, the soothing effect of the aloe, which helps some people. But the challenge with aloe is it does have a gut-related effect for quite a few patients, myself included. So We have aloe path, which is organic anthraquinone-free aloe combined with PEA. So you get the soothing effect of the aloe, especially on the urethra if you've got urethral irritation, combined with the pain-fighting effect of the PEA. And then last but not least, we have Cysto Mend, which was created for those people who love cystoprotek. And it's a very similar to the cystoprotek formula, but with the addition of pumpkin seed extract. And the reason why this got created was because cystoprotek started to become unpredictable with respect to availability. So, and there's nothing worse than having patients call my office and call me crying, "Where's my cystoprotek?" And I say, "I don't know. It's a manufacturer's delay." That's happening several times a day right now. So, guys, I want to give you one other piece of feedback here. Jay on YouTube says, "Didn't get the notification. Did anything change?" No, hon, nothing changed. So, I've been a support group leader for 28 years. I've been an online support group leader for 27 of those 28 years. I was the very first online support group leader for Bladder and IC Online. Started the first AOL support groups back then, and then built the IC network. And in the early days, I had a lot of people who got mad at me. They're like, why aren't you telling people my cure? I mean, I had some people who said that magnets would cure IC, that you had to sleep on a magnet, which is just bullshit. I had other people say, drink the juice of a lemon every day. That would cure IC. I said, you're crazy. That would certainly not cure IC. I had some people who said all the way back then, everybody should be on antibiotics. And again, you're crazy. No, that's not true. But it was a very heavy burden because I had nobody to talk to. I literally was the first person to do this and had to create my own rules. And so, or a set of new rules for IC Online, how to deal with a suicidal patient, how to deal with conflict, all that sort of stuff. That was something, we started doing 27 years ago. I also did a lot of live lectures online, and we still do live lectures, but everything's different now. Okay, so anyway, I was crying to the doctor at Tony Buffington, who was an IC researcher at Ohio State, one day because somebody was really mad at me because I wouldn't let them talk about their magnets. And they're like, free speech, I should say anything. And I'm like, no, honey, this is my website. This is not your website. You don't get free speech on my website. If I disagree with what you're saying, that sleeping on magnets. And of course, we later discovered it was a salesman pretending to be a patient. I can't tell you how many salespeople we caught pretending to be patients in our forum to try to sell stuff. But he introduced something called the Oxford Scale of Evidence-Based Medicine to me. He said, this is how you do it. Ask the companies for proof. And then you use the Oxford Scale of Evidence-Based Medicine to evaluate the information they give you. And so an F is a company selling you something or the opinion of a patient. A D is the opinion of a doctor, not supported by a research study. A C is a preliminary research study. A B is a better study. And A is a double-blind placebo-controlled study. So it's hard when I do these meetings because I'm a support group leader and I wear that hat first, but I also understand that some of you could perceive me as being a salesperson, and I don't want you to do that. I'm an F. I'm an F. Okay. All the companies are Fs in the Oxford Scale of Evidence-Based Medicine. I need you to do the research. My job is to introduce options, to open doors for you, to kick you in the butt and get you to start reading stuff and get you to go back to your doctor. But the reason why I did start having supplements in our store is because we had doctors who were telling patients that surgery was the only answer. And I didn't believe that. I believe that you needed a safe place that you could come to see all your treatment options. Okay. But so the purpose of this meeting is not to sell you anything. In fact, I'm giving you away stuff, but I also want to show you options. Right. Sue, I have followed your advice, physical therapy to supplement, stress reduction, special pillows, had my lesions cauterized. I feel great. Yeah, baby. Woohoo. Yes, I love success stories. Teresa says, got both of my COVID shots and there was no problem with my IC. Sue says, I had COVID. It was horrible for my IC. I had the vaccine with no problems. Eileen says, how do we get the magazine? You come on over to our website, the IC Network, and you can go into our store and you can either buy a membership or you can just buy the individual copy of our magazine. And for those of you who don't know, this is our magazine, the IC Optimist. And it's a really good magazine. I'm working on the spring one right now. I've got several writers that I work with, but I also write a lot of it. Righty, DJ, I went to see an infectious disease doc as my urogyne didn't wanted me to be on a prophylactic antibiotic. The infectious disease doctor said she couldn't put me on any antibiotics since my last 6 infections were completely different. I most recently had a MRSA infection and then a Klebsiella infection, then an ESBL infection, and then E. coli at the same time. Both went to my kidneys. What? Holy crap, girl. She also said that I should avoid any manipulation of my bladder and pelvic floor. She said that I shouldn't do physical therapy, which my urogyne said it doesn't increase the risk. Also, I get straight catheters for UTI checks, and the ID said no more. That's right, because when you insert a catheter, you're introducing bacteria into your urethra and potentially into your bladder. So I understand that. Although, hon, if you can't pay, that's a medical emergency. There are times when you do need to catheterize. Some patients make the mistake, though. They reuse catheters, and you can't do that. You have to use new sterile catheters every time. You have to follow sterile technique. You have to wash your hands. You've got to have a whole good protocol if you're doing any self-catheterization or home bladder installation. Borea says she had no problems with the vaccine. Joanne says, I run a huge support group on Facebook with 7,000 members who have all been wrongly diagnosed with IC. This is astounding and extremely worrying. Joanne, listen, support group leader to support group leader. The one thing that you should be seeing is the diversity in this patient community. For some people, IC begins in childhood. For others, IC begins after menopause. For some, IC begins after chemotherapy, while for others, IC begins after falling on their tailbone. There are no all or nothings in this patient community. There are none. This is why we're subtyping. This is why for the last decade, IC researchers around the world are working on subtyping systems so that we can try to understand what the hell is wrong with individual people. So if your IC began in childhood and you've got super sensitive skin, we know what that is. That's central sensitization, chronic overlapping pain conditions. I just wrote a huge article on that. And Joanne, I will email you my magazine because it will make you a better support group leader if you understand this, okay? So if your symptoms began when you were a teenager and you were an athlete, if you were a dancer, if you were a football player, if you were a gymnast, ice skater, odds are you probably have a tailbone injury or some sort of muscle injury, okay? Or you started using birth control, which would mess your hormones up, which would then potentially affect the bladder. If your symptoms began in your 30s, that's when we're going to start looking at wear and tear injuries, especially if you were an athlete, especially if you've had a couple of children or were in any trauma. We're going to start looking at muscles and nerves and dysfunction there. As Dr. Weiss says in his book, Breaking Through Chronic Pelvic Pain, we start seeing the muscular wear and tear injuries in the late 20s, 30s. If your symptoms began in your 40s, 50s, 60s, and you're a woman, we're absolutely looking at estrogen, dropping levels of estrogen influencing the bladder wall. Okay. And so there is, and then of course, we've got fibroid tumors, we've got Tarlov cysts, we've got endometriosis, we've got other issues, which absolutely can tweak the bladder and give you all the symptoms we associate with that. And that is why some patients are now being cured. They're being cured because we're finding the problem, like the woman with the bladder stone, right? So there's no all or nothing in this patient community. And anybody who says that, they are flat out wrong. All right. Kathy, the Johnson & Johnson vaccine has citric acid in it, so it might not be a good choice. Kathy, acid irritation of the bladder wall is dependent on quantity, and the tiny, tiny, tiny amount of acid that might be used in a vaccine is not going to get to your bladder to cause a bladder wall flare to any great degree. Compare that with drinking a cup of tomato sauce or lemonade. Okay, those are going to irritate your bladder if you've got IC subtype 1, IC subtype 2. But that tiny, tiny little bit of acid in that vaccine, it's just not going to arrive in your bladder in any great quantity. Thank you, Keith. Keith says these streams are so informative and brilliant. I appreciate that, hon. Hello, Sheila. DJ says, got my first COVID vaccine on Wednesday and I'm in a bit of a flare, but peace of mind is worth this flare. That's a great quote. That is a great quote. Peace of mind is worth this flare. I'm a type 1 diabetic, and 90% of type 1 diabetics who get COVID end up on vents. Egads, I didn't know that. I haven't left my house in 14 months except to go to the hospital or doctor's office. Ooh, girl, I feel ya. We are all now at that point of COVID exhaustion. It's true. It's true. I mean, I'm there too, guys. It's it's stunning, the toll. And like, I don't know about you, but holy hell, my TMJ has been so bad. It's so much so that I broke my 2 front teeth. We're still waiting for those teeth. These are temps. And now my left side, my worst, it's so bad that it's tweaking a nerve, like right here. So every now and then I get a little nerve that pulses because my muscles are so tight. There are some really good videos from physical therapists on YouTube for TMJ. One of the things they have you do is kind of this. There are some really good. I do them almost every day. So if you got TMJ, go over to YouTube and search for TMJ stretches. The physical therapists are great over there. D says, does anybody have cataracts related to Elmeron? Not that I know of. Elmeron's affecting the retina, not the lens. Sheila says, why is it the more I do physical work or go for a walk, my IC flares up? Because when you're more physical and doing more work, you're moving your muscles. And really what you've just done is giving yourself a de facto diagnosis of pelvic floor dysfunction. Anytime movement triggers your symptoms, we're always going to have to look at your muscles because your bladder wouldn't hurt by you walking. What hurts is your pelvic floor. And hold on a sec. And so let's look at this. This is my favorite prop, also a comedy piece for those of you who have watched me before. Okay. And I'm going to warn you, I'm going to come back with really short hair one day. As soon as I can go back and get my hair done, it's going to be here. All right. This is my COVID hair. So here we have the pelvic, the pelvic cavity, right? So here's your pelvis, the core and center of your human body. It carries the weight of your torso via your big hip bones because the bigger the bone, the more weight it is meant to carry. But it also deflects the stress of when you walk, right? If you, for example, if you fall, if you stumble, the forces of that go up your legs, through your bones, through your muscles, directly into your pelvic floor. You've got muscles in your lower back called your psoas muscles that come down both sides of the spinal cord. These are big, thick, ropey muscles that go up both sides. So if you ever have back pain, I often get a tension in my psoas. That psoas starts up here and goes right down into your pelvis. And the same is true for your thighs and your hamstrings. Those also come up into your pelvic area. So but here, look at this. Here's your pelvic floor, right? Here's your pelvic floor. These muscles are the only group in the human body that control major bodily functions. If they're not healthy, guess what? You're not going to be able to pee, and you're not going to be able to have a bowel movement, and you're not going to be able to have sex. If these muscles are tight, it's hard to let urine out, it's hard to let stool out, and it's hard to let a penis inside if you're a woman. This is your real pelvic floor, right here. This is your shallow muscles. These are your levator ani muscles. And actually, there are several muscle groups in here. They group them under the name levator ani, right? And so you can see three holes. Here we have the rectum, here we have the vagina, and here we have the urethra. So one of the things that sometimes happens with patients is you get a really narrow urine stream. It's like you're peeing through a freaking needle. That happened to me in 7th grade, right? I mean, I was diagnosed with a urethral stricture. I had about 100 urethral dilations, where they numb your urethra, they give you laughing gas, you're laying there, they numb your urethra, and then they jab it in there and you go, ah! And then, whatever. I mean, I was a kid having that. That's what they did back in the 70s and the 80s. Today, we go, oh, well, why would the urethra be narrow? Oh, look, it's the freaking muscles. So now we know, rather than to force the urethra open, which we can do in an emergency, we're going to instead look at muscles. And ironically for me, I had fallen and broken my tailbone. The number one injury we see in IC and pelvic pain patients are tailbone injuries. So now I know why my pelvic floor was tight back in 7th and 8th grade, because my levator anis were tight because I suffered a major injury here. I broke the tip of my tailbone off. I could move it with my finger for months. Okay, but here's the other thing you got to understand. Oh God, hold on. Wait. See, my foot just changed my, wait, hold on. Okay, see, you can call this the IC Network comedy hour half of the time. I drop things all the time. All right, but so now let's look at what goes inside of here for a moment, because I need you to understand how things influence each other. So first of all, again, these muscles, as you look at these muscles, do you see how flat they are? They're flat and they go along bones, right? They go along bones. They're not lifting through the pelvis. They're not going across the pelvis. They're going along the bones if they're healthy. Okay. So the first thing we're going to do, and I don't have a male anatomy, I need to get up. So let's just do the female one. So we've now put in a vagina and ovaries, right? And a vagina, uterus, and ovaries. Now let's put in the bladder. Hello, bladder. The bladder has arrived. And now you can see why you have bladder pain right above your pubic bone, because that's exactly where your bladder is, right? It's lower than that. I can't really get it in all the way in this model, but at least this gives you a sense of where it is. Now we got to stick in bowel. So we're going to stick in the bowel. Okay, so look, now we've got bowel moving in here. This is a very congested part of the body. And then you also have nerves. See all the holes back here in the sacrum? These are where nerves come out. This is where your pudendal nerve comes out in 4 branches and it merges. So now we've got nerves coming out. We got blood vessels coming out. And this is where Western medicine fails the typical pelvic pain patient, because doctors stay in their sandbox. Urologists focus on the urinary tract. Gynecologists focus on the reproductive tract. GI doctors focus on your bowel. They don't understand relationships. If you have a tight muscle, that muscle is now lifted off of the bone. It's tighter, it's rigid, and it's now going to restrict functioning in the blood vessels and the nerves, which is eventually going to tweak your bladder. And so you are an anatomical mystery to be solved. It is not just about evaluating your bladder. Your muscles can cause bladder symptoms. A fibroid tumor can push on your bladder and cause IC symptoms. And so this is about ruling a lot of stuff out. But one of the things we look for, getting back to what Sheila just said, is movement. If your symptoms, if your symptoms begin as soon as you sit down and they improve when you stand up, I can tell you exactly what that is. That's pudendal neuralgia. That means you have muscles so tight that when you go from standing to sitting, it's pushing on a nerve and giving you sciatica-like pain or persistent genital arousal disorder or pins and needles on your vulva, something like that. So if you have pain when sitting that is relieved by standing up, we're going to look at nerves and muscles. If you have pain with movement, moving, walking, running, squatting, we're always going to be looking at muscles. In contrast, if you have pain after drinking a cup of coffee or a soda or taking a multivitamin, then we're going to be looking at the bladder wall. So one of the tips that I use is I ask patients is, when is your pain the worst? Before you pee or after you're done peeing? If you have pain as your bladder's filling with urine that is relieved by urination, that helps us focus on the bladder wall. If you have pain not before you pee, but after you're done peeing, that's when we start focusing on muscles. But again, we have the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. They're both going to be involved, but one is going to be driving the other. And so again, you go back to me in seventh grade. I couldn't sit through class. I had frequency urgency. They thought it was infection. It was never infection. Bladder therapies, but that's what they did for years, is urethral dilations and antibiotics. Never worked. Now we know in hindsight that there was nothing wrong with my bladder, and there's still nothing wrong with my bladder, even though I'm absolutely an IC patient. It was all my muscles and nerves instead. Sylviane says, I would like to talk to you. Is there a way you can call? Yes, hon. I have a very important decision to make about my IC. You can email me, icnetwork@mac.com, or you can call our office. Our phone number is right on our website, icnetwork.org, right at the top of our page. And leave a message for me on the patient support phone line, and I will get back to you if I don't answer the phone. Mondays are my day off, guys, so I won't be working tomorrow because I'm working today. Okay, somebody from, I think, India. I'm not sure. I don't recognize your writing. Can you suggest a burning sensation supplement? Again, it would be a chondroitin-based supplement if it's your bladder wall, or something, but sometimes your brain interprets burning as pain and pain as burning. So I think Bladder Builder that would have PEA in it, or would be, along with chondroitin, would be a very interesting experiment to try. But come on over to our website. Joanne says, Cystitis Unmasked is the book you need. Oh, honey, that's not true. Not everybody has chronic infection, period. Chronic infection does not explain what happened to me in seventh grade. Chronic infection does not explain all those patients whose symptoms begin after having a baby. Chronic infection does not explain the symptoms patients get when they fall on their tailbone an hour later. They have frequency urgency. That is not the book everybody needs. However, if you do believe that you have chronic infection, and some of you could, the first thing we're going to look at, according to the U.S. National Institutes of Health, Science and Facts, is in fact fungal infection. The U.S. National Institutes of Health MAP Research Network, they discovered 7 years ago that many of you were flaring because you have a fungal infection in your urine, a candida infection. That too is science and fact, Joanne. So we're not jumping on the antibiotics for everybody bandwagon on the IC network. I'm sorry, I won't do it. I refuse to do it. But I believe in having a next-gen urine test. The proof is in the pudding. Don't guess. Let's get some facts here. Some of you could have chronic infection. Some of you could have a chronic viral infection. Polyoma BK is the virus we found. Epstein-Barr is the virus we found. Polyoma JC is another virus that they found. Again, our own National Institutes of Health. Or it could be a fungal infection. So I would want to know if you've had a candida infection. And yeah, some of you could have one of those really difficult E. coli-based infections. But we're not going to say that every single patient has infection. And that is also science and facts. There are dangers to taking antibiotics for long term. Dangers. Lisa says, 10 years, I don't ever get infections. I wouldn't want antibiotics. Like, come on now. I was diagnosed 27 years ago. I had symptoms 45 years ago, which tells you how old I am. I have only had 2 bladder infections in that time. 2. All proven with research. You guys, I'm now 30 minutes behind on questions on Facebook. I'm sorry, because I can go on and on. Lorraine said, has anybody flared from a COVID vaccine? Again, yes, small flares. Jeannie says, I wrote to the IC Network at Mac.com back on February 23rd for the free IC magazine. Okay, Jeannie, do it again and do it in capital letters. Say, Jill, send me the magazine. You guys, I get like 200 emails a day, and sometimes they go into my junk mail. Or, honey, you can just call me. Again, the phone number is right on the website. It's 1-800-928-7496. Either go to the corporate extension or go to the patient support line extension. And if we don't pick it up, leave your address there and say, hey, man, you promised a magazine. Can you send it? And I will. Okay. But admittedly, I'm going to say probably 25% of the freebies that people ask for don't get sent out because I either didn't, like one lady I was going to send our Echo egg to, and I never got her email. I never got it. And I still want to send it to her. So if you've ever been one of these meetings and I said I'd send you something and I didn't, please send me an email or call me and let me know, because I want to make it right. Boria, thank you so much for the 50 stars. Amy, thank you so much. Patty says, I have a bottle of cystoprotek. I've only used a few pills out of it before stopping it, if anyone doesn't mind. Okay, so Patty, that's technically, well, you can sell anything that you own except for prescription meds, but don't do that through the IC network, okay? That's really shaky. Thank you, Dee. Dee says, you're doing a great job through all the years I've been associated with the IC network. Thank you. Joanne, I know Joanne says, but so many people are wrongly diagnosed due to terrible urine testing. Hun, that's true. A urine culture is based upon a agar. It's based upon a growth medium. Only bacteria that eat that growth medium will grow. That is why typical urine cultures miss a lot. But that still doesn't mean that everybody has infection. They don't. They don't. A lot of patients have muscle injury instead. So thankfully today we've got next generation urine testing. We've got better testing. We can now tell you if you got fungus in your urine. We can tell you good bacteria. We can tell you bad bacteria. We can even tell you virus. So that's not true today. And again, if you're not getting better, if you're getting worse over time, what the American Urology Association says is take a step back and revisit the diagnosis. Did we miss something? And again, this is where this book is so good, because it goes through everything you could have missed. And again, I got 10 books to give away. If you email me, icnetwork@mac.com, I need a flare management tip And I need your mailing address, and 10 of you will get the best version of this book, which is a full color print. Okay? IC Network at Mac.com. My job here is to educate you, to empower you, to get you to walk into your doctor's office as an active participant, to get into your doctor's office prepared to ask the tough questions. Patty says, "Tell me more about your magazine. I missed it. I was doing pretty well for years, but your IC's back with inventions because you think you're prolapsing." So that is true. That if you've had a number of babies or you strain, if you've been strained to have a bowel movement, you've been straining to urinate, that is a sign that you have muscle issues. And a prolapse happens when, hold on. Here, gotta take this out. All right, so a prolapse happens when some of these muscles get so weak that they don't keep your organs in place anymore and they start to fall out. So you could have a urethral prolapse, you could have a vaginal prolapse, or you could have a rectal prolapse if these muscles get truly screwed up. The minute you feel like you're starting to prolapse, where you feel a hard lump down there, like at the entrance to your vagina, that could be your bladder. Um, um, that is something you want to talk to your doctor about, because you don't want to, if they catch it early, they can strengthen the muscles and you won't need surgery. But if you wait and you strain and you strain and you strain and you strain and you overstrain your muscles to the point that they have no strength in them anymore, then they might need instead to do a suspension surgery to lift things up again. Because if your bladder, so if this is your bladder and if it flops over like this, then your bladder won't drain properly. And yeah, you could end up with a lot more bladder infections because of that. Another sign that you have a little bit of a prolapse, and this is something I don't have a prolapse. I have I have a really, really mild one. And so again, I have no shame. I will talk about anything. You know that. If you ever find that to have a bowel movement, you have to push like right here to kind of pop it out, that means you have a little bulge in your rectum that's kind of going to your vagina. And so if you just push on it, stool will come out, which is obviously I'm familiar with this. That means that you have the start of something, and you want to talk to your doctor about that. The same is true if you have to push to release urine, then that's the same thing. We're working right now on a brand new app that I'm really excited about, because it's going to automatically record the time that you pee. And then there's going to be 5 very quick questions. You can fill it out in 5 seconds. But the whole point of the app is that you will be able to print out weekly or monthly reports that will show you your progress or lack thereof. And more importantly, you will be able to put it into your medical records. If you ever feel like you need to apply for disability, it will be objective evidence that you have frequency, urgency. And so that's something that we're working on now. Finally, it's going to cost thousands of dollars, but I am excited about it. Hello, Shell. Shell's is my first time into a live. Oh, welcome, Shell. Nice to meet you. Mary says, IC is not a valid diagnosis. Infection must be ruled out with adequate testing. Oh, well, honey, of course it does. But the majority of women do not have embedded infection. I'm not going down that pathway. Joanne says, leaving chat now. Please put up a live once you've read the book. Yeah, I will read the book. I have it, and I really appreciate it. Oh, we've been invaded. We've been invaded by infection people. Amy says, if I jump, I feel my bladder. Could that be pelvic floor too? I'm scheduling a pelvic floor PT this week, but my pelvic floor assessment seemed pretty normal. Going down the list of treatments until something works. So far, aloe vera is the only thing that's working. Um, as we get older, the loss of estrogen means that our muscles are not going to be as strong. So our pelvic floor muscles start to get a little bit weaker. And so I'm gonna say that if I were to jump, let me try. Now I have a hard time jumping because I got this damn ruptured disc in my back. I can jump on my left leg, but I can't jump on my right leg. Okay. Okay. Do not feel my bladder. Okay, I can't jump on this leg. That's all I can do. Okay. But I will say that the few couple of times I've tried a trampoline, I have felt a little drop come out. Amy, that's a great question. I'm not sure. I mean, have that pelvic floor assessment, see if they find anything. Tell her that when you jump, you feel your bladder, especially if you feel a drop of urine coming out. Let's see if she can figure it out. Are my glasses crooked? Or is my head crooked? Okay. Okay, guys, please do not use my meetings to recruit for your group. That's just so inappropriate. This is my group. It's not your group. DJ says, I have endo, and that was the reason for I had a hysterectomy. And when I woke up from the hysterectomy, I immediately felt like I needed to pee. The nurses were like, no, you don't, and tried to give me more pain meds to knock me out, but the urgency didn't change. I ended up spending the entire 2 hours in the toilet with urgency, and it wouldn't let up. I was at the Florida Cleveland Clinic. And despite my post-op complications that let me go home overnight, I had a radical hysterectomy, so no more ovaries, tubes, or cervix. Me too. I had that 4 years ago now. And I was sent home 2 hours after my surgery. Girl, I get it. Heavy-duty pain medicine on board, but the urgency was so strong that it didn't help at all. When I got home, it continued for another 3 hours until the meds kicked in. I broke my tailbone in 9th grade, and I also have PCOS. Girl, it's a wonderful website called Hyster Sisters for people who have had hysterectomy or are considering hysterectomy, and the information in that's really, really good. You are not alone, DJ. You're not alone. Eileen says, mine is when I'm laying down. So Eileen, when you're laying down, sometimes that puts pressure on a nerve. On my left side, I've gone through periods of time where if I laid down, I had pain in my left butt cheek, and that was from a muscle compressing a nerve. Shell says, I just had my permanent InterStim placed on Tuesday. I hope you're doing well, hun. Amy says, I appreciate you so much, but you sound quite down on hydro, and I heard you explain why, but it really works for some of us. I wouldn't want to scare someone away from this option because it can really help. Hannah, I'm not scared. My intention is not to scare anybody away from hydro. What do I always say? I always say, stop guessing. You need facts, and and if you're not getting better or you're bleeding from your bladder, whatever, there comes a time when you have to let somebody look in your bladder. You can do a cystoscopy in the office, or you can do a hydrodistension. If you choose to do a hydro, you have to make sure that they are going to do a low pressure, short duration hydro so that it doesn't hurt you. I had one 4 years ago. It was a piece of cake, no problems at all. But that's a question you have to ask. There are a couple of questions you have to ask the doctor before you have a hydrodistension. So number one, what are you going to do if you find a Hunner's lesion? And if the doctor says nothing, you're going to say, why? Normally you treat a lesion at the time you find it. One of the saddest stories, I very consistently see this in our office, are patients who have been in pain for years who they found Hunner's lesions, they never treated them. And so the American Urology Association is crystal clear. It says, if you find a Hunner's lesion, you treat it at that time. You do not send somebody home with an open Hunner's lesion. What do they normally do? They cauterize it. They laser it. They might inject it with a steroid, etc. Okay, so what are you going to do if you find a lesion? Number two, are you going to do a low pressure short duration or a high pressure long duration? If the doctor says, don't tell me what the hell to do, I'm going to do whatever I want, you're going to slowly back away and thank you, sir. But I would prefer doing what the American Urology Association recommends, which is a low pressure short duration. Are you willing to do that? The doctor says no, then I would not be doing it with that doctor, because that's why the AUA changed it, is because the high pressure ruptured bladders, so low pressure does not rupture bladders. And I think the third and really honestly, the most important question to ask is, are you going to provide pain care? Now, when you stretch a hollow organ, think about how bad your stomach hurts if you eat too much food. The worst thing you can do to a hollow organ is stretch it. And so when you stretch a bladder, it has the potential of hurting, especially in the old days with high pressure long duration. Um, uh, uh, it's very, very important that you have a little bit of pain care. I mean, we're not talking a month's supply of Norco, but what we are saying is a couple of days of Norco might be necessary. I also wouldn't do it on a Friday. I would do it on a Monday or Tuesday. So if you have some sort of complication, you know your doctor's going to be in the office. Um, the other common side effect with or adverse event with a hydrodistension is infection. If your symptoms suddenly get worse 2, 3, 4 days after the procedure, then you might have picked up an infection from the procedure. It's a very, very common. So again, normally they give you an antibiotic either in your IV or even potentially even in your bladder. But if you have the hydro and suddenly things get much worse, 48 hours afterwards, 72 hours afterwards, you always call your doctor. We got to make sure you didn't pick up a post-op UTI. But again, I had one. I'm very grateful that I had it. DJ says, I now wonder if the whole time that I was experiencing IC flares and not endo, I had endo everywhere. And the surgeon who did my hysterectomy tried to remove the endo from my bladder. And I also wonder if him doing so started the IC. Well, I think it's all about, what does IC mean? IC means potentially bladder injury, frequency, urgency, pressure, pain. So if you had endometriosis on your bladder, the question is, did it burrow into your bladder? Did it stay on the skin, or did it burrow in more deeply? If it did, then that certainly could be causing some issues. Helen says, I recently started Bladder Builder and feel better than I have since 2003. Awesome, girl. I love it. Belladonna homeopathy pellets are for bladder pain I'm using. Is there research? I don't have any research on that. Debbie says, thank you for doing this live. I'm new. Your website helped me so much. And I've learned more on this live. Awesome. All right, guys. So normally at 2 o'clock, we start our Zoom meeting, and this is where you can come in and ask questions. Debbie, it's MAC, M-A-C. Okay. So let me start up the Zoom meeting. It is time for a potty break. Everybody, y'all need to pee, go get a drink. And let me start up the Zoom. Then I'm going to go use the restroom myself. So hold on one sec. To get into our Zoom meeting, you go to our website, icnetwork.org. And you go to the support pull down menu, and it's the second link, streamed support group meetings. And then you're going to go to the Zoom link, and that's what I'm doing right now. And let me launch this meeting. All right. God, I always shock myself. It's like, oh man, looking at my face is not fun sometimes. You know how you scare yourself when you look at your face and go, oh, who's that? Where's my young face? All right. All right, so let me go ahead. I'm also going to put the invites in so that the Zoom meeting is now functioning. All right, so Facebook, let me give you the link. So if you want to come in and ask questions, all right, so Facebook has the link. YouTube, hello, my friends on YouTube. There is your invite. All right, quick bio break. Come on, I will let you into the Zoom one at a time. Give me a minute. All right, I'll be right back. The only thing I have eaten today is so it's not good. So let me just stream is so icky though. All right, look at all you people. All right, we're gonna let Cindy in, Amy in, Shelly in, Emma in. All righty then. So I'm leaving Facebook and YouTube. Oh, and by the way, hey, Facebook, have you had any interruptions? Has it stopped and started at all, this stream? Did we finally fix the internet? You know, Robin says, ICN was a lifesaver when the doctors couldn't tell me what was wrong and treated me like I was a pest. You were there to let me know what I had was real and help me cope with it. Thank you. Oh, Robin, I'm so glad. You are not alone, my friends. You are not alone. Okay, so for those of you in Zoom, I want you to know that people on Facebook and YouTube are going to hear you. They're not going to see you, but they are going to hear you. So if there's something that you want to remain confidential, don't say it here. You can call me later. Oh, and this is a great look at that. Yeah, we don't need to ask that. That's backup. All right. So again, oh, good. Helen says it has not stopped today. That's good. Let me post your invite to Zoom one more time. So Facebook, there you go. YouTube, here you go one more time. All right, my friends on Zoom, look at your beautiful faces. Let's go with Shelly first. Now, listen, guys, don't take it personally. I just randomly pick people. Y'all came in at the same time as far as I'm concerned. But Shelly is there smiling at me right now. So I'm going to say, hello, Shelly. How are you today?
I'm doing okay. I'm the one who just had InterStim done on Tuesday, so I'm recovering.
Okay.
But I'm pretty excited because I can already feel a difference in the urgency and frequency. So I feel like
Nice.
it's going to be successful for me. So
Excellent. Excellent.
I've had interstitial cystitis since I was 13 years old. So also about 27, 28 years. So,
Okay. Okay.
yeah.
So, what was it that led you to go to InterStim? What?
Well, I did pelvic floor therapy. I've done, through this time, I've done Elmeron. I've done a bunch of natural stuff that I don't even remember. It seems like I've tried everything, and just nothing seems to work to help that side of things.
Well,
so it's like,
and the good news, no longer say nothing.
Right.
Because
right.
we've got and that's absolutely true. There are some people whose symptoms are driven quite neurologically, and by remodulating those nerves, that can kind of calm things down. And we also know that sometimes that can relax muscles. So when you had,
yeah.
So when you had your pelvic floor assessment, what did they find with your pelvic floor?
They did say that it was very tight. Like, so I was going twice a week at first. Is what she wanted me to do.
Okay.
I did that for a month, and literally every single time I went in, it was back to where we started. Like, we weren't getting anywhere.
Okay.
And
okay.
So
Keep going.
Yeah, go ahead.
I'm listening.
And then, so she had me do some vaginal estrogen.
Okay.
Kind of do internal massaging of the muscles in between visits.
Okay.
And so it's like we got a little somewhere, like it ended up loosening up a little bit, but still was almost to the same place we started every time. So she actually had me talk to my urogynecologist, and she just said, I think it's time that we talk about something else.
Okay.
And
yeah.
So we're still going to continue with the pelvic floor after recovery.
Okay. So have you seen me talk about this book, Breaking Through Chronic Pelvic Pain?
This is my first ever visit here.
Okay. Well, I'm so glad you joined us. That's great.
Yeah.
So this is the book of books for all things musculoskeletal. It's called Breaking Through Chronic Pelvic Pain, and it's by Dr. Jerome Weiss, who was a pelvic pain specialist here in San Francisco for decades. He's a urologist who saw back in the 70s and 80s that urology therapy, bladder therapies, didn't work for a lot of people. And so he changed his practice and started focusing on other structures in the pelvis. And he eventually became the myofascial god. When it came to muscles and nerves and ligaments, he was the guy that did the best assessments and the best therapy. So, but what baffled him is if you walked into his clinic, and you know what? I know my eyes are moving. I gotta center this, so I'm looking straight at you. Okay, now I gotta center this one. All right. So what absolutely baffled him is that he could spend an hour working with somebody and get rid of your trigger points and calm the nerves down. But he didn't understand, why did the trigger point come back in exactly the same spot? Why did the muscles get tight in exactly the same spot? He's like, what the hell? We fixed this 2 weeks ago. Why is it back? Why is it back? And that is what this book is all about. Because what that means is that there is something beyond the muscles that are putting pressure on those muscles, specifically bones.
Yeah.
And we had a very interesting research study come out last summer that showed that 70% of the men with testicular pain had an underlying hip problem. So
I've actually had both my hips replaced, and one I've had done twice. So I've had a total of 4 hip replacements.
okay, there you go. So let's see. So what makes his book so good, bless you, whoever that was, what makes his book so good is that he focuses on bony structure abnormalities. So yes, it makes sense to look at the hips. It makes sense to look at the SI joint, because for me, it's my left SI joint. And it also makes sense to look at the knees, right? Because if the knees are messed up, like I have my right knee's messed up right now, you're limping, which is putting stress on your pelvic floor, right? But the chapter that will blow your mind is the chapter on the feet.
Oh.
Because he finally, I mean, he's just how do I describe it? Some doctors are like Energizer bunnies. They have so much energy, it's stunning. It's like, oh my God, just slow down. You're so crazy. They can just go for hours and hours. They have this zest, this energy for their career, but they also have a zest for knowledge. And his zest for knowledge was just incredible. And it got us where we are today. So somehow he's like, I wonder if the feet are involved. And he connected with a podiatrist. And they were able to determine that 90% of his patients who had long-term chronic pelvic tension were not walking correctly. That it came down to a foot abnormality. And the diagrams in this book, let me see if I can. He explains exactly with the diagrams what happens to the pelvis if you have Morton's toe, Morton's neuroma, if you have an ankle that's bending to the inside or to the outside. And he shows in diagrams how that tweaks the pelvic floor. And let me just see if I can find that. He also believes that quite a few patients have more nerve damage than they realize. Here it is, the sacrum and the feet. So let's see here. Okay, here it is. This is a classic image. Okay, so here we have somebody whose ankle is rolling in on the inside, right?
Mm-hmm.
You can see that. So now let's look at what's happening to the positioning of their bone. So you can see on this leg, the knee is in a normal position. Their femur is in a normal position. But now look at this leg. First of all, look at how it's tweaking the knee. And so the outside side of the knee is flexing more than the inside of the knee. But if you come all the way up here and you look at the piriformis muscle, here's a normal piriformis muscle on this side. Here is a stretched piriformis muscle on this side. Okay. So he calls it, it's like revealing the layers of an onion. You just have to take layer after layer after layer off. So your hip replacements are absolutely involved. Did your symptoms start before your hip replacement or after your hip replacement?
Before.
Okay. So your hip replacements would have potentially exacerbated your normal muscle function. Combine
Absolutely. And I believe it because like maybe 2 years after the first replacement is when I had my most recent flare, like not flare, but like everything restarted over again. I had kind of like a period of not many symptoms at all.
Right.
And then all of a sudden it was like, boom,
right.
It hit and it hasn't really gone away since. So.
Right. So, and then of course your hip replacement is absolutely going to be affecting how you're walking, the recovery, all that sort of stuff. It's very, very challenging. So hopefully, in addition to doing bladder therapies, which which at this point in time haven't worked for you particularly well, and that makes sense given the fact that your muscles are messed up. You will be spending as much time as possible working on muscles and walking and stabilizing and all that other stuff too.
Yeah.
Make sense?
Yes, it does.
Yeah, honey. But I'm so glad you joined us today. This is great. Did you have any questions for me?
No, I just really kind of wanted to dive in and just, in 27 years of having IC, I've never been to a support group or anything like it. So,
isn't that fun?
Might as well dive in.
In my first couple of years, I had symptoms for 2 years before I started my first support group. I felt like there was something wrong with me. I felt abnormal. I felt that that people could look at me and see I was really messed up, right? And when you actually go to a support group meeting and you meet other people, you realize that we're all completely normal people in an abnormal situation.
Right.
It really just gives us context here because there's nothing, I see, and this and your injuries and all that, it doesn't affect the person we are. You're still a lovely woman. I think you're married because I see a picture, looks like a wedding picture on the wall behind you.
I'm actually a grandma.
Oh, congratulations, hon. I'm so happy for you. So please, I hope that you will join us again. And if you ever have any questions, now listen, with InterStim, the thing with InterStim, did you get the one that's MRI safe? They've got the new version.
Yes.
Okay, good. Excellent. If you notice anything unusual, if you notice a shocking sensation when you have a bowel movement or anything like that, call your doctor and let them know, okay? Because that can happen. It's not common, but just there's kind of this perception that once you get an InterStim, you're fine and you can go on your way. But you really have to be thoughtful and monitor it and just ask yourself, does it feel right? Does it feel good? Because sometimes they have to tweak the settings, adjust the settings a little bit. And so just kind of be on top of it, be vocal if there's anything that doesn't quite feel right. But so far you're doing great. Power to you, hun.
Yeah, I was a little hesitant at first because I have arthritis in my lower spine.
Oh, yeah.
And I also have fibromyalgia. And so it's like just the thought of, okay, I'm going to do something that can aggravate both of those things. Just recovering from a surgery itself is just, it's tough. So, but for me, it was the right decision. And I always, tell people, for me, that's how I always preface things, is for me, it was a great idea.
Yeah, good. Well, keep us posted on how you're doing. I'd love to keep in touch with you. Okay.
Okay. Thank you, Jill.
Very nice to meet you. All righty. Let us go to Cindy. Hello, Cindy. Can you unmute yourself? There you go.
I can. I don't have a whole lot to say. I'm just the last lady. I just wanted to tell her best wishes, and I really hope she does well. I guess my main thing right now is just getting through this COVID thing and getting it over with. I'm ready. How about you?
Aren't we all? And then you think about what's happening in Texas right now. I'm sorry, I'm just going to say it.
What is going on?
An idiot of a governor. Well, Texas is the dangerous community right now because he just told everybody to go back to normal, and unfortunately, immediately ICU nurses and ICU staff started posting saying, "Oh my God, don't! We're still full of COVID people." So, please, everybody out there, just keep wearing a mask. We got to get through this for another 6 months. Pray that we don't get a state. The problem right now is that if they tweak it and they cause an upsurge in COVID in Texas, it will spread through the United States through plane travel. So if you got relatives, so everybody, just like the president said in his speech last week, just hunker down. If we can just get through the next 3 months, everybody will have vaccines by the end of May. That's going to help tremendously. So we've gotten this far. You know, what's that great affirmation? You've never been more prepared to deal with whatever happens to you than you are at this very moment, because you are one day older and one day wiser.
Right.
And we are all wiser now because of this.
Yeah. I think anxiety, like I love the Optimist the last one. I finally joined and read it. And the flight or fight.
Yeah.
Fight or flight is me.
Yeah.
Constantly using that method that you talked about last week. I do self-cath. I do get a lot of infections. The protocol for that, I'm not sure what that, I mean, I do wash my hands. I use gloves. I still
Why
myself.
Why are you self-cathing?
Because that's what the urogynecologist had me doing, because I don't empty.
Why don't you empty?
Because my muscles are tight.
Yeah.
Because I went to physical therapy.
Okay, so we have this nice loop right here. So again, you are the perfect
and
example.
I have an infection right now, and they called me on Friday and said they want to put me on an antibiotic daily for the rest of my life. I don't want to do that.
Yeah, that's definitely not the but you've got a unique situation here. You're not emptying, and because you're not emptying, urine is sitting in your bladder more. Any bacteria in your urine are going to have a greater opportunity to infect the bladder wall. You're also of a certain age where you don't have a nice thick coating of mucus, so there's a higher chance of those bacteria infecting the bladder wall. Right? Are you using your estrogen?
Yes.
Okay, that's
twice a week.
So important. Be on top of that. And the next time you go to the doctor, have them look at your skin quality to see if 2 is enough, maybe you need to be doing 3 times a week. I just have them look at your skin and see.
Should I ask about the microgen for me?
I think it'd be. So how many infections have you had in the last 6 months?
Oh, in the last 6 months, maybe 2, but in the last year, probably 10.
And were they all cultured out positive?
Yes.
And what were they? What were they?
E. coli.
Okay. And do we
From
know?
capping.
Okay. So a next gen test would, I think, be really important for you, because the value of next gen testing is it identifies drug resistant genes. So when you have a next gen test, not only does it give you the list, the list of everything they find, they also identifies drug resistance genes, so that you don't waste time doing an antibiotic that you have a known resistancy to, so like for me, and I wish I could show it. I don't know if I have it on this computer. Here, hold on. I think I have it here. So I've done 2 next gen tests, and both tests identified that I have that my normal flora has a resistancy to amylase antibiotics. Now, my training's in pharmacology. As far as I know, I have never taken an amylase antibiotic. The only way I could have been exposed to that is through food. But it's meaningful data. You know what? It's just meaningful data. Hold on. Let me just go through my files here. I know I have a printout of my last next gen test. Oh, y'all want to see an interesting picture? This is one of my favorite pictures. Look at this, guys.
What is that?
That is a bladder.
A bacteria?
No, it's a bladder stone. So this is in a gentleman who's now a very dear friend of mine, who called me. He thought he had IC, but his pain was always in one spot. Make a very, very long story short, he's a surgical malpractice case. A doctor did a surgery on him and left him with gangrene in one of his seminal vesicles, and it took 13 surgeries to find it. In his last surgery, So he's not an IC patient. He is a surgical malpractice, and the doctor who did it is in jail now. So it turned out he did it to a lot of people. It was in the state of Utah. The last surgery to deal with the gangrene, they left a bleeder in his bladder, and his bladder filled up with blood clots. They sent him home. They didn't realize they'd left a bleeder in here. He'd go back to the doctor's office. They do emergency surgery, and as they cutting him open, his bladder exploded. It just split in two, and all these clots came shooting out. It was just a high pressure issue. And his life was in jeopardy. So they cauterized it, they sealed it, they cut it, they sewed his bladder 2 pieces back together. And this is what happened. Along the incision line, crystals grew out of the incision. And apparently, when you have a severe injury, a calcium metabolism mechanism gets messed up. And the tissue doesn't know how to process the calcium correctly. And the calcium comes out in stones through the bladder wall.
Oh my God.
Okay, now guys, this is not IC. Just to say. But anyway, I love telling his story only because I got him to one of the best IC doctors in the world, and they fixed it, and he is fine now.
Oh, good.
But anyway, hold on. Let me just see if I can find this next gen test. I have to redo all of my slides. Well, anyway, it's buried. It's buried here somewhere. So again, getting back to the next gen test, the cool thing is it will identify any drug resistant genes, and that's the data you need. So,
okay, I'm going to do it.
Yeah, yeah. All righty.
All right. Well, it's good to see you.
Okay, but hon, I want you guys, Cindy, we got to learn something from Cindy here. Okay, so Cindy, you just made the perfect case for the connection between the bladder and the pelvic floor. So you have urinary retention because your pelvic floor muscles are tight.
Right.
And so here we've got, and now you're having to catheterize to empty your bladder.
And I have prolapse too.
Right. So for you are absolutely IC subtype 3 pelvic floor driven. Mm-hmm. And to get to that cure or heal, it's all about restoring muscle tone and muscle function. And so, and again, I don't remember if you have this book or not. I would want this book and remember, it's free on Kindle Unlimited, so no excuses.
Breaking through chronic. Okay.
Okay, because as you're working on trying to repair your muscles, I want to make sure we haven't missed a bony structure abnormality like a bad foot or a bad knee or a bad hip.
Well, the physical therapist found something with my left hip when she was doing the internal.
Yeah.
Oh my gosh, I about jumped off the table. She said, "That's your hip."
Okay, so follow through on that. You might,
yeah, I will.
You might want to go see a physiatrist, a physical medicine specialist, to see if they can try to identify what's wrong with your hip. Because if we can fix that, then we can fix the ripple effect.
Okay, cool.
So we've just got this ripple effect: hip, muscle, bladder, bladder, prolapse, etc. So let's try to understand what that anatomy is about, and that's when we can really talk about curing people, is if we can fix that. And that's what Dr. Payne said in his subtyping program, is that patients with pelvic floor can be cured. And if that's
really good news.
Yeah.
Yeah.
So, all right,
is not fun.
It's not fun,
so much.
But you're a tough cookie.
Yeah, I know I am. Take care.
Okay, you too. Bye-bye now.
Bye.
All right. Okay. So, Kayleen, it looks like you're eating. So how about are you eating? You're not? Okay. Faye, if you don't mind holding on, I'm going to come to Kayleen and then I'm going to come to you. Okay.
That's fine.
It's only just the order you are on my screen. So Hello, Kayleen. How are you doing today? How is your life?
Pretty good. It's just we're still trying to figure out this mystery. Like,
Right?
um, I'm still not getting the diagnosis from the doctors, but then they're treating me like an IC patient.
Okay.
They're treating me like an IC patient. And this was like mind-boggling to me. But I had to have a colposcopy on February 5th. So I had the test, the COVID test and the urinalysis done on like the 2nd or the 3rd or something like that. And it's bad. Like, it's like gravity was high, something WBC esterase, that was high, protein, ketones, urobilinogen.
Okay.
There was blood, which I wasn't on my period.
Well, but microscopic blood, not visible blood. We all have most of us have a little bit of microscopic blood in our urine. That's no biggie. If you were peeing blood, that's a whole nother story. But that little bits of microscopic blood are completely common in the IC patient community.
It said white blood cells, red blood cells,
Yep.
bacteria, which I know that's normal. And then squamous and calcium oxalate was really high.
Oh, isn't that interesting?
So that's why, like, it made me think, I'm like, oh my God, like I got, kidney stones or bladder stones. And I'm like, but I mean, I have no symptoms. Like I pee 2 or 3 times a night. It's been a while and I've told you guys about it. You haven't done anything about it, So I'm like, I don't know what else to do.
Well, let's talk about the calcium oxalate for a moment. So, do you drink a lot of almond milk?
No, but I do drink milk because I'm low on vitamin D. Vitamin D.
Okay, but you can take a vitamin D. Why don't you take a vitamin D rather than the milk?
I can't afford it.
Okay. Well, honey, tell you what, if you send me your address, I've got some vitamin D in our store and I'll send you some. Would you email me, icnetwork@mac.com, and I would be happy to do that for you. Because I don't even think it's live in the store, but I do have some, so I'd be happy to send you some. Okay. So calcium oxalates are, there's calcium, which is one crystal, and then there's oxalates, which is another crystal. Together, they form the most common type of kidney stone. And many times kidney stones happen because of an overconsumption of calcium or an overconsumption of oxalates. And so we learned from the vulvodynia community 20 years ago that so urine that is high in oxalates is known for irritating skin. It's essentially microscopic crystals that are very sharp that are kind of cutting your skin as you're peeing them out.
Yes.
Okay.
That's what it feels like. It feels like I'm peeing needles.
Right. So, have you reduced your high oxalate foods?
I don't know what.
Okay. So it's going to be spinach, almonds, berries.
No, for those.
Here, hold on a sec. Let's see. The Vulvar Pain Foundation, they're the ones who really focused on that. And it's certainly, so the book that I just pulled out is called A Taste of the Good Life, a cookbook for an IC diet. It's out of print. You can't get it anymore. I tried to buy it from Bev just so I could reprint it because it's so good. This is the first book that was ever done, and it actually ranked all the recipes for oxalate levels also, because we knew that long ago that oxalates were an issue. So let me just see if I can find her list of high oxalate foods. I guess I should look at the table of contents, you think? Hold on.
Well, I get to see the urologist tomorrow, but that's because of something really dumb I did.
Okay. Hey, you don't have to share it if you don't want to. We all do dumb things.
Well, I learned my lesson to not have sex after, or the day after a bladder installation.
Yeah.
Um,
Or you know, I mean, one of my lessons was, oh, I can't even go there. It's so embarrassing. But it was it was related to sex and sex toys, and yeah, it didn't work so well. Well, anyway, you can Google high oxalate foods. But spinach, chocolate, berries, and there are more. So you have a lot of control over your oxalate intake. And the same with the calcium. You know, you certainly would not be a candidate for using pre-leaf, because pre-leaf gives you more calcium, right? So pre-leaf is that supplement that reduces acid level in your urine. But if you take too much of it, you'll have an excess of calcium, which could lead to kidney stones. So you should not be using pre-leaf at this point in time either. I'm sure your doctor would tell you that. So ask your doctor. I'm sure they'll be able to print out some kidney stone, even though you don't have a stone, quote unquote. You have all the conditions for stone formation. Okay. And so see what kind of information, if your doctor can hand out any information on the foods you should avoid because of that. That's really interesting to me.
Yeah, it was really weird. And then days later, I mean, I had to, you know, right after the COVID test, I had to quarantine, so I couldn't go to the ER. I couldn't go to, you know, urgent care to go and get a urinalysis because the my OBGYN is from a different organization as my urologist. So I did call them, and I'm like, oh my God, like my urinalysis looks like this. It's got a bunch of red explanation points. Like my grandma said that she has cancer, and like hers looks better than, you know, than mine. And I'm like, I'm freaking out. So I went ahead and did get one after surgery. Well, after the colposcopy. And oh my God. So it's not letting me see it, but it was clean. I mean, it was like my urine was like, it was super clear yellow, and I'm like, oh my God, like my urine hasn't looked like this. And
yeah, but honey, your urine changes. Your urine is going to change content literally every hour of every day, because your urine is a direct reflection of what you've been exposed to in the previous 2 hours. And so there are going to be times when you know your urine might be cloudy and you might not have infection. It's just cloudy because of some metabolite of something that you've eaten. Just like if you had drunk soda or something like that, your urine would be more acidic. But the good news is, so it changes. The other thing we're learning about the urinary biome is that it's different based upon where they sample your urine. So that if urine is sampled in your urethra, it's different than urine that's sampled in your bladder, which is different than urine that's sampled in your ureter.
Right.
You know, so the location of it is, I mean, this is the miracle of the human body. We still don't understand some of the importance of why that is. The protein in your urine is something you're going to have to talk to your doctor about for sure. Right. And let's just see what your doctor has to say. I mean, this may just be, there may be some simple dietary changes that might be helpful.
It's so frustrating.
I know, hon. I know.
like give me the diagnosis, or if I really don't have IC, then find out, what's
Well,
wrong.
well, remember, you don't walk in and say you have IC. You have to walk in and say, here are my symptoms. Can you help me understand what structure in my pelvis is causing these symptoms? Right?
Right. I've even walked into urgent care, and I didn't say anything about IC, and he's like, have you been checked for it? Have you had a cystoscopy? And I'm like, yes, I have. And I'm like, my urogynecologist, she really screwed up. I wish she was in jail right now.
Yeah.
She just, I mean, it was a couple of years ago, and I was going to school at the time. Like, I was just fighting through the pain, and I mean, the bladder spasms. Oh my God! And then laughing like in class because the teacher was so funny. It made all the pain worse. And I went to my cystoscopy, and then I went right straight to school, and I was in so much pain. And she had said that everything was normal, and so obviously she's going to put it on my notes. And I went to my urologist, and I was like, well, she screwed up. So do I have IC? Because, I have all this pain. And he's like, no. He's like, definitely don't have it. And I'm like, well, can you do a cystoscopy? And he's like, no, I'm not going to do it. So I'm like, thanks, like for now messing
thanks for
everything
nothing.
up.
Thanks for nothing.
Yeah. I mean, my urologist, he is amazing. He's doing his job.
Okay, so did you send me an email for this book? Facing Pelvic Pain. This is the book that will review all the things that can cause these symptoms besides the bladder.
You did give me the Jerome Weiss one.
Okay, I want you to have this one too.
Okay.
Okay, would you send me an email so that I can send this to you?
Yeah.
Do you have email right now?
I do have my email, but I just want to write down yours.
Okay, mine's really easy. It's just IC Network.
Okay.
So IC Network at Mac, M as in Mary, A as in Apple, C as in Charlie.com.
Okay. So.
Okay, and I'm gonna take one of these and I'm gonna put a Post-it on it, and this is your copy. Okay, so when you send me an email, you're gonna get this book.
Okay.
And this, and again, guys, for everybody listening to this, you can't focus on the word IC. It's not specific enough. And when we say IC, you fall down the rabbit hole of people's belief structures. It's so important that instead you be prepared to talk about your symptoms. We have to talk about the symptoms and say, doctor, okay, I'm getting up 3 times a night. I have not had a full night's sleep in 5 years. I get this weird pain on my left side that vibrates a little bit. Every now and then it flutters. Do you have that?
I have like this bearing down problem, which I am in pelvic floor now.
Okay.
And we're trying to work on bladder training.
Okay.
Because she says that I'm going too much throughout the day.
But what do you mean by bearing down problem though? What does that mean?
Like
straining?
No, when either bowel movement or just urinating. It's like there's this thing on my left side. It's like a crusher.
Yeah.
And it just it moves down, and as it's moving down, it's causing the side pain, and then it gets to the bottom and it really hurts.
Is it something in your bowel?
I think so, because of me having all my problems with IBS.
So, okay. So that used to happen to me too all the time, where if I ate oatmeal or chocolate, which are the 2 things that were my triggers for IBS, wherever that was in my gut, it caused the tissue to spasm. And so I didn't start feeling it until it hit my large intestine. And so I would feel it. I'd feel the spasms first on my right side, and then it would spasm across, because this is where your large intestine crosses, right?
Mhm.
So it's spasm here, it's spasm going down the left side, down to the left hip, and then from the left hip to the rectum. That was the agony. That was what I call bend over and screamers. Like you're just literally in the toilet going, oh God, oh God, oh God, please, please come out. And then once it's out, you're good. It stops immediately. It's just whatever, there's a chemical or something or an allergen in the stool which triggers a spasm. Does that sound like what you're having? Do you feel it starting and moving?
Well, it just stays on the left side in the exact same spot, like all the time. But it's not agonizing pain. I
Okay.
mean, it's like, oh my God, ow, 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 ow. And that's
Okay.
pain.
So if it's not your bowel, then we got to figure out what the hell's wrong on that left side. And I would be asking the doctor, what structure is present at this location that could be triggering this pain? Could it
I
be?
think it might also be my SI.
Yeah.
Because of the degenerative disc disease.
Okay.
It's L4 and L5 is the problem, and
Me too.
it's pinching my left side and then down my leg, and so it does kind of domino. Like it's at my hip, and then it just kind of spreads out, and that's the agony pain.
So do you have active low back pain every day, or is it more in your pelvis and your leg?
Yes.
Okay.
Active low back pain.
Okay. So
Yep.
it would be really interesting to see if PEA could reduce some of that nerve pain. What medicine are you on to calm your nerves down?
I don't think anything. I'm just on Tramadol if I need it.
Okay. What about
And
Neurontin? Did they ever put you on Neurontin to try to calm your nerves down?
gabapentin?
Yeah.
Yeah. I'm on 400 milligrams a day.
Does it help? Do you feel like it helps you?
I think.
Okay.
Okay. I mean, it's working really good with my anxiety.
Good.
ADD medication. So.
Okay. Okay. Well, your case is a classic, again, kind of orthopedic origin, in the sense that you have a significant issue at L4, L5. Those are where the nerves that support the bladder and the pelvis, enter, for lack of a better term. They all merge basically at that location. I have a bulging disc at my 4 or 5 now too, and it sucks. The fact that you have pain shooting down your leg is a nerve that's being compressed in some way, or has been injured in some way. And so, are you working at all with an orthopedic surgeon on what you should be doing for that?
Just a neurosurgeon and pain management, but for right now, more my neurosurgeon because we're prepping for surgery.
Okay, and that surgery is going to be on 4 or 5?
Yes. Or between 4 or 5. I don't
Right.
know. He makes a single, like he goes in with a rod and works in there and everything. But yeah, it's just a neurosurgeon. And then it kind of makes me nervous too.
Yeah, but girl, you're a tough cookie. You got this.
Yeah.
And it sounds like it's important.
My PFPT, we're not only doing pelvic floor, we're doing my back too.
Good.
And that that's the only way that they said that I could have physical therapy is if I'm having both,
Right.
for my back and my pelvic floor.
Right.
So
Right.
it's like, all right, thank you for finding that, but
When
we
is
still
it?
got to find out
Well,
issues.
I know, but I know that it doesn't seem. It seems like you might have something else going on, but I suspect that they're all associated to a certain degree. And working on your back and getting that fixed is, it makes sense. When is your surgery? When are you going to have it?
June 28th, but
I have to write this down.
it's everybody writes it down. Everybody I've told my therapist, my psychiatrist, I don't know, everybody there.
I like in the week before, I hope you'll call me or let me call you, because I want to give you a pep talk. And I want to send you some flowers. And I want you to know that we will all be thinking very, very good healing thoughts for you.
Yes.
You got this. You're a tough, there are moments when saying tough cookie isn't good enough. Sometimes we have to say to ourselves, I'm a tough bitch. I'm going to get through this, which is what I have been known to say to myself when I'm facing stuff like that. So anyway.
This is the name I gave myself since my college, which I had to drop out for now just because of my health and everything. But now I got color shirts. But they sell the brand, so I'm like, I'm gonna buy me a couple of shirts. So
yeah,
I'm a champion.
That's what
I wear them to my doctor's appointments and all of that. And I'm like, I'm a champion.
Here, you know what? Let me go get what I've been wearing the last week. Hold on. Matter, and I just, when I'm feeling like I need to be tough. Now this tells you that I'm a gamer.
Oh, ninja.
Yep. Like I have a whole bunch of ninja stuff, but look at the back.
Yeah, his symbol.
I mean, like, honestly, I feel like a badass when I'm wearing this sweatshirt. I do. Yeah. I feel like I can walk into a situation prepared to be a badass if I need to be. I don't know. Yes. I just get such comfort. I mean, come on, I'm 60 years old and I wear a gamer's stuff. But symbols matter. Right? Yeah. Anyway, there you go. I can't wait for the next line because I'm going to get the next two.
Well, I should think about getting one. Or if he starts selling like champion, I'm going to be a champion ninja.
And the champion reverse weave cotton joggers are to die for. I have 2 pairs of those. I have 2 pairs of reverse weaves. So, well, listen, let's keep in touch. I really care about you, and I want to make sure that you have everything that you need to get through this. And you send me your address, and I will send you this book because I really think it's important for you. Okay?
Okay.
Okay, hon. You got this. Do you watch streams much? You watch Twitch a lot? Because you do know Ninja, so.
Yeah. Well, I used to watch him all the time, but he doesn't ever come on.
I know. Well, he's on late now. He was on last night, but he's not playing Fortnite. Like I loved watching. I love watching Fortnite with him and Tim and Courage and Lupo. Oh my God. Those were the best streams ever.
And he's in Illinois, which is, I think he's like 2 hours away from me.
Yeah.
So
yeah. And
so cool
so he's an example that for those of us that are geeks, you can you can make $1 million business too. So anyway, well, listen, I've got to run. Big giant hug to you. Okay.
All right. Thank you so much.
You're very welcome. All right, Faye. Hello, my
Okay.
friend Faye. How are you doing today? How is life?
I wish I put on makeup.
Oh, you look beautiful. You're
I just saw this coming up and spontaneously came on. First of all, I want to say that I found that conversation about the feet really interesting
Yeah.
because I saw a podiatrist last year,
Uh-huh.
and I thought I just had the I'm going to lose words now.
That's okay.
The plantar fasciitis.
Yes.
Okay.
Yeah.
That's what I thought I had. That's all I thought I had. And he x-rayed my feet and he told me that I also had Achilles tendonitis.
Ooh, okay.
So I had both. That's a sports injury. I'm not athletic. I have no idea how that came about.
Well,
And
yeah.
so I have all this going on with my feet. I can hardly wear any of my shoes, and my feet continue to get bigger.
Did you wear a lot of high heels when you were younger?
Oh, yeah.
There you go. That's why.
Yeah. And now they're just getting bigger
Well,
and sore, and they hurt.
well, you need to talk to your podiatrist about that. Your bones are not getting bigger as you get older. Your soft tissue is getting bigger, and or you might be collecting some fluid in your feet.
Well, I've asked about the fluid because they look swollen, real swollen in that soft tissue.
Yeah.
Around the ankle, they look really swollen. But I've had my endocrinologist and the podiatrist feel that, and they don't seem to think it's actual swelling.
Do you
Might,
have you gained weight in the last couple of years that could you think maybe relate to that?
I'm about the same.
Hmm.
About the same as I have been the past couple of years. I've been about this weight for probably at least 5 years. But anyway, I just thought that was interesting because I am having so many problems with my feet. I also have the degenerative disc disease.
Right.
And that is, I will be 73.
No way. You do not look 73. No way.
Yeah, I think I do today.
No, you don't at all.
I'll be 73.
Okay.
And honestly, I can't believe it when I say it.
It's weird. It's weird.
I'll be 73. And when I was diagnosed with osteoporosis.
Okay, your voice is fading out, hun. What's happening to your microphone? Were you covering it with your hand?
I may be.
Yeah.
Is that better?
That's better. Much.
Okay. I started having interstitial cystosis pain just a few months after my wedding in 1964.
Uh-huh.
And I went to a urologist who took my insurance money, never diagnosed me, and did all sorts of invasive procedures. And so that went on for months. I mean, I wasn't diagnosed until the next year.
Okay.
And I was finally diagnosed at Vanderbilt by a female urologist.
Okay.
And I did that. I purposely sought her out because I had read the book by Larry Gillespie.
Oh,
Remember
yeah.
that one?
Yeah.
Remember that one?
I do. That was the first book we all had.
That's right. And I found out about IC, and I just walked in, and I did tell her what I thought was wrong with me.
Uh-huh.
And she looked at me very oddly and said, that's a pretty stiff, she didn't say stiff. She said, that's a pretty difficult diagnosis. How did you come to that conclusion? I said, I read a book.
Uh-huh.
And I sort of felt like that person that was being described. But anyway, they took me into the OR at Vanderbilt, and I did a cystoscopy and distension, and diagnosed me with interstitial cystitis. I had Hunter's ulcers.
Okay.
I was in tremendous amount of pain.
Okay.
And I came out of that and came home with the catheter still inserted in a bag. And over the years, as I did telephone support work at home and took telephone calls from patients, I began to realize that there was nobody else who came home from that.
No, you had a bladder injury from the procedure.
I did have a bladder injury. They perforated my bladder.
Yeah.
And I confronted my doctor about it. Finally, her admission was sort of like, well, we didn't know then how fragile the IC bladder was. Well, they found out.
They found out. Well, that's exactly why when the American Urology Association put their new guidelines together, if you look at the guidelines, and since you did telephone support, you really should read the AUA guidelines. I think you will find them very interesting. They admit a couple of things in the guidelines. They admit, number one, that patients traditionally stop going to the urologist because they were injured in some way. They were hurt in some way.
I quit going.
Right. And so the entire intent of the new AUA guidelines is to ease trauma, to reduce trauma, that they admit that was a barrier to care. And they admit that some of the early tests, remember the days of chlorpactin and silver nitrate back then?
Oh, yeah.
Oh, my God. There was a brand new study about chlorpactin, and I forget where it was. They want to do chlorpactin again, and that stuff hurts like hell.
And silver nitrate was horrible, too.
Oh, yeah.
I never had that. I just had the DMO stuff.
Right.
That never helped me.
But you have to also think about how far we've come today. If you were diagnosed with IC back in the 70s or the 80s, it
was the 90s.
Yeah, but in the 70s, you would have been condemned to silver nitrate treatments, chlorpactin treatments, and urethral dilations. It was 60s, it was urethral dilations. 70s, it was urethral dilations, chlorpactin, silver nitrate. 80s, it was towards the end of the 80s. They were using DMSO more and Elmeron more, but all that information we had back then has been completely replaced because now we have subtyping. And because you did support, like I've been doing support, patients are so different. And we have a perfect example here with who we're talking about. So we have Kayleen, who has an L4, L5 spinal issue going on, right? And then we've got Shelly, and Shelly also, if I remember correctly, now, Shelly, you have to bear with me because I am 60 and my short-term memory gets a little bit funky at times, but you also had muscle stuff going on, correct? Right? And, years ago, we were all told it was bladder stuff. We were all condemned to antibiotics and oral meds. It never got better. And so if you look at the Chris Payne, and if you email me, I will send you Chris Payne's article on his subtyping proposal. He said, listen, it is so unfair to tell patients this is an incurable bladder disease. It's not. It's a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved. And for all we know, you and I were working with patients who had endometriosis burrowed into their bladder wall, or they had, a bad leg, or they had an SI dysfunction, or they had polycystic ovarian syndrome, or they had pudendal neuralgia. And the gift that we have today is that we can do such an individualized diagnosis that we can give them better therapies. We can give them pain-reducing therapies. And so for that situation where we've got muscles so tight, they're now compromising the nerves, we now have urinary retention, we've got a need for catheterization. In the old days, they would have been doing dilations. Today, we're going, okay, why is she retaining fluid? Retaining urine. It's because her muscles are screwed up. So we're doing so much better now. Did you have a question today that I can help you with?
I have a really important question.
Yes.
I am signed up. I have an appointment. My husband and I both have an appointment on next Saturday
Okay.
to get the Johnson & Johnson COVID vaccine.
Yeah.
Okay. And what I want to know is how patients with this process going on, the IC and other things, and especially what I want to know about is the patients who have like a syndrome, an autoimmune syndrome, because I know that these vaccines amp up the immune system. So if my immune system becomes amped up, is that going to cause me to go into pain again?
You're going to have to ask your doctor about that.
I did.
Yeah. What if you could go back and rewatch the first hour of this video? We went into that in depth, and several patients reported that they had the vaccine with no problems at all. And then another patient, at least one patient, said that she flared for a week. But when you compare that to the dangers and the risks of active COVID infection, because again, we're doing the only COVID IC study so far, and what our study shows is that 75% of the patients who get COVID go into flare, and 25% go into very, very severe flares that last for months. And we think that's because the virus is infecting the bladder. And I did a big article on it on our website and in our magazine, where we have 4 studies that have found kidneys infected with COVID, 14 studies which have found active virus in urine. And so it's not unreasonable to suggest that perhaps the virus is also infecting the bladder in that 25% of patients who are reporting severe symptoms.
Would you believe I found an article last night? I wish I had saved it. I'll try to find it again and send it to you. I found an article online last night suggesting that they are thinking there is a possibility that COVID could be an autoimmune thing.
Well,
I don't know.
Well, you got the long. You've got the.
I asked my doctor about all this, and his answer was this. He said, "I think it would be worse if you got COVID. I think that the possibility of that would be worse if you got COVID."
I agree with that
because
completely.
what happens is it causes the autoimmune system to start chowing down on your organs, so to speak. He didn't use that terminology, but and destroying your organs. So he said he thought it would be a lot worse if I were to get COVID.
I agree with that. 100% agree with that. So the thing you got to understand about COVID is it's not just a respiratory virus.
No,
it is a circulatory system virus. It attacks the blood vessels. And one of the and even though therapies are better and fewer people are dying, the reality is that for some patients, they're long haulers. And I was working with one IC patient last week who is a long hauler, and she's had extensive fatigue now for months. She had it last spring, and 6 months later, she's still struggling. We don't know the degree of damage that's happened in a long hauler. I know I read a study last week in which they found a big molecule in the blood vessels of the brain that is normally found in bone marrow. And somehow this big molecule is now traveling throughout the body, and it's so big, it's part of the bone marrow system, but it's arriving in the brain and it's causing brain symptoms. So again, so I think that your doctor is absolutely right that having the virus is much more dangerous than having the vaccine. And remember, it's the first shot's normally fine. It's the second shot where you probably get fever for 2 days and feel like you have the flu. But that's actually a good sign because that means your immune system's kicking in. And so, there you go. So here you go. Shelly says here in the chat for Zoom, I had COVID back in April. IC flare about 4 months. Chronic fatigue is still there. And she's had the 2 Moderna vaccines, and they didn't affect her bladder. Thank you, Shelley. Thanks for sharing that.
Thank you. Yes, thank
Okay.
you very much.
All right. Well, listen, hon, good luck. We're all in this together, and we're just going to come together every week or every other week and share our stories and support each other. You are not alone.
I know.
Okay. All right. So guys, time is happening. So I've got to end the Zoom meeting and I got to go back to Facebook and YouTube. So thank you so much for coming today. And I will see you all again. All righty. Have a good one. I'll be thinking good thoughts for all of you. All righty. The Zoom meeting is now down. Straight Out of Blue Ridge says no sound. Do you still not have sound on Facebook? I don't know what would happen there. Becky says, does this book talk about sexual dysfunction due to nerve and muscle problems? Becky, let me look. I mean, it goes through all of the gynecological conditions that can play a role. I'm sure it discusses sex. I know it does because I remember reading that section of the book when it first came out. They sent me a galley copy because, yeah, chapter 18, how does sexual activity affect pelvic pain? All right. So it is, it's viable. All right. So again, I'm giving away 10 copies of Facing Pelvic Pain, the master version with the full color inside and out, courtesy of Dr. Elise Day, who is a urologist at Harvard Medical School, who's one of the editors of this. Yeah, for you to be eligible, I need you to send me an email, icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie. And I need a good flare management tip and your mailing address. If I don't get a flare management tip, you're not going to get one. Tell me what works for you, because it's all about creating a master list, right? Because you teach me. You might teach me something that I want to know. Shell says, I'm so glad I hopped on. I appreciate everyone's openness and participation. Yeah, you know what? Yeah, I think it's very important. Hello, David. That we just get real here. We got to get real here. These things happen. Not our fault. No shame, no blame. All right. So last call for questions. Last call for questions. We have been here for 3 hours so far. Any last questions? Otherwise, I'm going to give you your homework for 15 minutes a day. I need you to do something that will nourish your spirit, because this is hard, especially with COVID. Guys, we're tired. We need to feel good physically, mentally, and emotionally. So if there's something that you can do that will lift your spirits for 15 minutes a day, I want you to do it. And for me, what is it? I tried to walk yesterday with my weird leg. Yeah, that didn't go so well. But anyway, get out in the sun. For 15 minutes a day, I need you to just do something for your bladder or your pelvic floor. For God's sake, make a good choice with food and get yourself on your floor and do your exercises, or whip out your glass wand and do your internal work. Consistency matters here. We're trying to retrain these tissues to be healthy. For 15 minutes a day, I need you to do something to improve your knowledge, right? And so come on, you can read a chapter a day. We're not in school anymore where anybody's forcing you to read something you don't want to read. This is about you wanting to get better so that you can talk with your doctors and have really good discussions about what your treatment options are. And then for more than 15 minutes a day, I'd love for an hour today. Seriously, I want you to laugh. We got to get laughter in the, remember, if you're in pain that is accompanied by anxiety is intensified by the brain, but pain that is accompanied by laughter is minimized by the brain. So please do something fun or funny. Watch some videos, watch TikTok, all that sort of stuff. If it will make you laugh, power to you. All righty. All right, my friends. Well, since I have not eaten, I gotta finish my yogurt. So I'm going to call it here. Y'all know how to get a hold of me. IC Network. Whoops. icnetwork.org. You have my email address, icnetwork@mac.com. I do take Mondays off. So I will not be returning phone calls tomorrow unless it's a very urgent one. Sometimes I start answering the phone late in the afternoon. Otherwise, I should be around for the rest of the week. I wish you well, and I may do a drop-in meeting too. I love to do drop-in meetings. So I will see y'all later. Have a good one. All right. Facebook is gone. All right, YouTube, my friends. Be well. I'll see y'all later.